Hello, everyone. My name is Jane Scimeca. I'm a doctor of physical therapy, and I have been working in the physical therapy field for over 31 years, and I've been practicing as a physical therapist for over 25 years. My undergraduate degree is in exercise science with a minor in psychology, so I learned very early on the importance of the mind-body connection, and I've incorporated that into my work with my patients from the very beginning. And then I became certified in applied functional science and have taken a lot of courses in that direction. And what that means is that I treat with a whole body approach. So I don't just treat the site of symptoms, I also look at the whole body because oftentimes the source of symptoms is not at the site of symptoms. And then I eventually became a certified holistic manual lymphatic drainage practitioner, which is why I'm here today to talk about the lymphatic system. So let's get started. I'm going to share my screen. Okay. So again, we're going to be talking about the lymphatic system, and we're going to talk about easy habits that create big change. And this session is for educational and informational purposes only. It does not constitute medical advice, diagnosis, treatment, or physical therapy. Participation in any techniques is entirely voluntary. So I first want to give credit to Dr. Perry Nicholson. His Instagram handle is Stop Chasing Pain. I've learned a lot from him. I've taken a lot of his courses. I'm part of his membership program, and I participate in his case study discussions on a monthly basis. So I'm always learning from him, and he's a great wealth of information. So you should check him out. And I also want to start with an analogy of a bathtub. So let's say you have a bathtub that's full of dirty water and you want it to drain, and you go in there and you swish around and you move that water around. If the drain is not open, then that bath water is not going to drain out. So that's the importance here, is that you have to be able to drain properly in order to properly detox. So you can't just push out toxins before the exits are open. So I'm going to teach you how to tiptoe into that, because with the lymphatic system, you have to tiptoe into lymph work. You can't do too much too soon, and or a certain technique at the wrong time. There's timing, there's pressure changes that have to occur in order to move the fluid. So you just have to be patient, and more does not necessarily mean better. You have to tiptoe your way in. And then also, I like to use the analogy of a suitcase. So let's say you're going on a trip and you have all this great stuff that you want to bring with you on this trip. You set it aside, you go and you open your suitcase, and your suitcase is full of junk. And you cannot bring any of that good stuff with you until you remove the junk first. So that's the same with healing. There's so many great healing methods, but if you're trying to do too much before your body has space for it, or before your body is in a receiving mode, it just isn't going to help. So I'm going to teach you ways to tiptoe into emptying that suitcase as well. So let's get started here. Some gentle considerations when it comes to lymphatic drainage. You want to skip techniques if you have a current fever, active infection, a known blood clot, uncontrolled heart failure, open wounds, rashes, or skin irritation in the area, or active cancer. You always want to clear that with your doctor first. But the optional techniques today are not formal manual lymphatic drainage. These are gentle lymph supportive, and nervous system regulating techniques using light touch, breathing, and movement to support comfort and regulation. So I'm going to be showing you some anatomy pictures, because when the brain understands the why, the body is more willing to respond. So I like to start with anatomy pictures, because when we see pictures and understand what's happening in the body and why we're doing something, it helps the nervous system feel safer and the body becomes more receptive to the techniques. So this is a picture of your lymphatic system. It's basically the sewage system in the body. It's part of your immune system. It removes waste and toxins from the body. In the body, the fluid is clear, but in the picture, it's green, so you can see it. We have about 600 to 800 lymph nodes in the body. A third of them are located from the neck up, and there's a lot of lymph nodes in the abdominal region as well. So there is no pump. Um, Unlike the blood has a pump, which is the heart. The lymphatic system does not have a pump, so it relies on breathing, muscle movement, and fascial glide to move the fluid, which I'll talk about in a moment. So the drain for the lymphatic system is actually at the collarbones up here. So you'll see that a lot of the lymphatic system is at a disadvantage because it's has to go up against gravity in order for it to drain. And because the lymphatic system goes everywhere, symptoms don't always make sense. So, lots of times you don't have symptoms where the congestion is. So, oftentimes the symptoms are downstream and the congestion is upstream. So, for example, you can be having some foot pain, but the congestion is not actually necessarily at the foot. Lots of times it's upstream, oftentimes in the abdominal region. So this is a great picture of your fascia. So if you imagine the body as an orange, the fascia is the white pith that connects and supports everything inside. So you can see on the left side, that is healthy fascia, and on the right side, that is dehydrated fascia. So hydration is only one factor. Stress, movement, and nervous system state also affect fascia, but I thought this was a great visual for you to see that when your fascia is hydrated and healthy, it allows for efficient movement, lymphatic drainage because the lymphatic system travels through the fascia, emotional balance, improved detox, stable energy, and it also reduces joint pain. And then this is, I wanted to show you a picture of the lymph nodes at the head and neck area. We have a lot of lymph nodes and they go underneath the chin. And this is from another angle. You can see that there are a lot of lymph nodes that go underneath the chin, and the largest lymph nodes in the neck are actually located underneath the ears on both sides. That's where the vagus nerve exits the skull as well, which we'll get into in a moment. And then I also wanted to show you the lymph nodes at the abdominal region. So the abdominal muscles are removed in this picture, but I wanted to show you this long muscle here. It's called your psoas muscle, spelled Psoas, and it has some attachments to your lumbar spine. It also attaches to your femur, so the inside part of your thigh bone. And so when we are stuck in fight or flight, our body has this primitive reflex that wants to curl us up into the fetal position into a ball. And that's basically the body wanting to protect itself. It's wanting to protect its vital organs because it doesn't feel safe. And so lots of times that fight or flight um, status will affect your back because your psoas muscle is that muscle that wants to reflexively pull you into that fetal position. So it's wanting to go into that position and it's super tight. And so that's one thing that um, I stress with my patients that have back pain. We have to work on nervous system regulation first because it is that sympathetic dominance reflex that is pulling us into that flexed posture. And then the diaphragm at the top here, this dome-shaped muscle here, that also has some attachments to your lumbar spine. So when you are in that flexed position, that diaphragm does not move well or pump well as well. So it's important to incorporate nervous system regulation into your lymph work. So this is a great picture here of all the different systems of the body. So the red is the arteries, the green are the veins, and then, I'm sorry, the green is the lymphatic system, the blue is the veins, the yellow are the nerves. And so you can see that you can't go in there and just tease out the lymphatic system or tease out the vagus nerve. All these systems work together. So no system functions independently. Every system influences and supports the others. So speaking of systems, let's talk about the nervous system. So I'm not going to go through all of the items on this slide, but what restricts fluid flow? So nervous system imbalance, that fight, flight, or freeze that results in shallow upper chest dominant breathing, which means that we're not using our diaphragm to pump the fluid. That nervous system imbalance, that stress results in stiff fascia, tight tissues, persistent muscle tension, nerves that don't glide well, etc. So let's talk about the nervous system now. So let's talk about the autonomic nervous system. So underneath the autonomic nervous system is the parasympathetic nervous system that's responsible for rest and digest. The sympathetic nervous system is our fight or flight nervous system. And so I like to use the analogy of a brake pedal and a gas pedal. So your parasympathetic nervous system are the brakes in your car. The sympathetic nervous system is the gas pedal in your car. Lots of times in sympathetic dominance, we're stuck in fight or flight, and that gas pedal is floored. And so we're trying to do all these techniques to put our foot on the brakes, but our foot is actually still on the gas pedal. So we need to take our foot off the gas and put our foot on the brakes to help regulate our nervous system. So, you have what's called sympathetic chain ganglia. That's a paired chain of nerve relay stations that run along both sides of the spine from T1, which is your upper back on both sides, down to the beginning of your low back. And that distributes fight or flight signals throughout the body. So the upper thoracic, so T1 to T4 ganglia, they strongly influence the heart, lungs, upper chest, neck, and blood vessels, which are areas that are commonly involved in stress and nervous system regulation. So light touch in that area reduces unnecessary sympathetic drive, like easing pressure off the gas pedal, and parasympathetic practices such as diaphragmatic breathing, humming, and gentle movement help apply the brakes. So combining taking the foot off the gas pedal and putting your foot on the brake pedal, that equates to nervous system regulation. And then you should be able to go back and forth easily between the two nervous systems, not stuck on one. So that's the healthy regulation, is being able to go back and forth very easily. So the vagus nerve is the longest nerve of the body. I love this picture because it gives you a good visual of where the vagus nerve goes. So it's the longest nerve of the body. It's the main nerve of the parasympathetic nervous system, which helps the body rest, digest, and calm. So it is a cranial nerve 10. It starts in the brainstem inside the skull. It exits the skull underneath the ears on both sides. It comes down the throat, comes close to the esophagus. It goes to your heart and your lungs, and it goes to most of your organs in the abdominal region. It doesn't go to all of them, but most of them. And here's another picture of the vagus nerve here. I highlighted it here so you can see it. It exits the skull underneath the ears on both sides. And then the vagus nerve, because it goes to so many different organ systems, it affects so many different organ systems. So here's an example of some things. So it goes to the heart, liver, gut, it suppresses inflammation, it helps the brain, so it poses the body's response to stress. It goes to the mouth, so it's important for taste, gag, reflex, swallowing, and coughing. It helps to lower blood pressure. But one thing to note here is that serotonin, that feel-good hormone, 80 to 95% of that is actually made in the gut. So it's really important to keep our guts healthy. And we can do that by having a healthy vagus nerve, a healthy vagal tone as well. So here are some daily habits that support lymphatic flow. They're very easy. So it's not like I'm asking you to go out there and run a marathon. It's just very easy things that you can incorporate into your daily life. So you want to make sure that you stay hydrated. I like to tell my patients half their body weight in ounces. I also like to add minerals and electrolytes to water, loose clothing at night. So some women have that I know that patients that I know, they wore bras at night and they thought that it would help with support, but actually you just want to picture that lymphatic system picture that I showed you in the beginning. Anything that is going to um, disrupt that flow back up to the collarbones, you just have to keep that in mind. So I say no bras at night, and you don't want to sleep in tight leggings or tight waistbands. You want to sleep in loose clothing at night. The exception is medically prescribed compression, like if you have lymphedema or burns, or if you had like a total joint replacement and they have you wearing compression stockings, you want to follow your doctor's orders. And then comfortable bras during the day. So you want to avoid excessive pressure around the chest and collarbone. So you don't want those really super tight straps at your shoulders or super tight strap across the trunk there. So comfortable bra. And then movement is important, especially walking, because the muscle contraction helps pump lymph. And then proper posture that opens lymph pathways and supports breathing driven flow. And it opens all those lymphatic vessels in the front of your chest there. So your sternum, your collarbones, your diaphragm, that kind of opens up that whole front area, even the abdominal area when you have proper posture. And then diaphragmatic breathing, you want to do that periodically throughout the day because the diaphragm acts as a natural lymph pump. So I wanted to put a picture of the lymphatic system and the vagus nerve side by side here because you'll see that when you do diaphragmatic breathing here, um, that's going to pump the lymphatic system. But you'll see because of the so much of the vagus nerve goes to the abdominal region, you're also stimulating the vagus nerve as well. So breathing has a lot of other benefits, but I wanted to show you at least this picture that it does benefit the lymphatic system as well as the vagus nerve. So let's talk about something that I think is fun if you are a dog lover, that there have been some studies that measure stress markers and hormones before and after an interaction, either by urine tests or blood tests. And basically, what this one shows is that mutual eye contact between dogs and their own owners increases oxytocin, which is a bonding, calming hormone in both humans and dogs. So, oxytocin supports parasympathetic activity, it promotes calm, safety, and nervous system regulation. And humans and dogs can co regulate each other through connection. So, how great is that? Just pick up your dog, spend some time. 5 to 15 minutes with a dog, as little as 5 minutes, has been shown to increase oxytocin and reduce stress markers. And for those of you who are cat lovers and are wondering about cats, I did look that up for you. And with cats, studies suggest the calming effect of cats are primarily on the human side, not so much on the cat side. But still helps to regulate your nervous system. But for dogs, it keeps them healthy, it keeps us healthy, and makes both sides feel good. So why not? All right. And then I'm going to show you some studies about movement, music, and nervous system regulation. I listed some studies at the bottom here. And so when the nervous system is stuck in fight or flight, the body is scanning for threat. Rhythmic movement tells the brain nothing is chasing me right now. So studies show that music and movement support healthy cortisol rhythms, increases parasympathetic activity, improves heart rate variability, not heart rate. So heart rate variability measures how flexible your nervous system is, not how fast your heart beats. And a higher HRV is equated with better nervous system adaptability, resilience, and recovery capacity. So let's talk. Before we talk about that technique, I just wanted to share something that I learned over the last year. And I've learned to honor that my nervous system has been protecting me for a long time. And I began teaching it that it is safe to soften. So, safety is so important. So, when our body does not feel safe, it can't heal. So it can either stress or it can heal, but it can't do both at the same time. So it's important to teach our body safety and allow safety as well. So here's the beginning way of doing that. We're going to do a morning lymph technique. It's just the length of the song. It's super easy to do. You're going to play an uplifting, inspirational song that gets you going in the morning. Okay, so you're going to hit play on that song. Then you're going to sit or stand in good posture. So you're going to go tongue up. So if you say the letter N, where your tongue is while you're saying the letter N, you're going to keep your tongue there, lips together, and teeth slightly apart inside your mouth. This signals safety to the nervous system. Okay, and then you're going to quickly and lightly massage like you're smoothing silk. So you don't want to be tugging at your skin like that. You want to be very smoothly gliding over your skin, like smoothing silk. So we're going to start. Remember, we talked about rubbing on the sides of T1 and T4. So we're going to start at the upper back on the right side. So we're going to go right here. So you're going to feel that bone right here. That is at the base of your neck, the one that's sticking out there in the center. That's your C7. You're just going to go off to the side a little bit, and you're going to rub up and down 5 times. And then you're going to do the other side. 1, 1, 2, 3, 4, 5. And if you can't reach that, you can use a back scratcher or a massage cane if needed. And you're going to repeat that on the left side. So I'm actually going to stop sharing my screen so you can see this better. Okay, so let's do that again. So what you're going to do is you're going to rub. So here's that bone that sticks out that base of your neck. You're going to go off to the side. We're going to rub 5 times. 1, 2, 3, 4, 5. And then we're going to go to the other side. 1, 2, 3, 4, 5. And then we're going to rub underneath the collarbone. So I'm going to go on my right side, use my other hand, and we're going to rub 1, 2, 3, 4, 5, and then above 1, 2, 3, 4, 5, and then we're going to go on the other side. So if you have any implantable devices, you do not want to be rubbing over those implantable devices. So like a pacemaker or a sleep apnea device, sometimes it's close to the collarbone. So you don't want to be rubbing on that. So anyway, so let's rub underneath the collarbone as long as you don't have an implantable device. 1, 2, 3, 4, 5. Then above the collarbone, 1, 2, 3, 4, 5. And then we're going to do 5 shoulder blade squeezes. So you can put your arms at your sides like this. Okay, you can do it this way, or you can put your arm at your side with the palm up. It's up to you. I'm going to do arms at my side with the elbows bent, and you're going to squeeze your shoulder blades, and for 5 seconds you're going to lift your chin very slightly. So we're going to squeeze, and we're going to inhale through the nose at the same time too. So inhale, squeeze, 1, 2, 3, 4, 5, and then relax. Again, 1, 2, 3, 4, 5, and then relax. Again, 1, 2, 3, 4, 5, and relax. Again, 1, 2, 3, 4, 5, and relax. And then one more time. 1, 2, 3, 4, 5, and then relax. And then for the remainder of the song, you're just going to move to the beat of the music. So it could be easy as swaying, tapping your foot. It could be actually dancing. You can put one hand on your chest and kind of like move and tap. Whatever resonates with you, I want you to try that. And you would do that for the remainder of the song. So let me go back to sharing my screen so we can do the rest of the technique. Okay. And so, okay, so we're at this point here. So then move to the music for the remainder of the song. It can be easy as swaying or tapping your foot. Then you're going to do humming or singing along. That activates vagal pathways in the throat, which helps to calm the nervous system. And then the bonus parts, you can do diaphragmatic breathing during steps 1 through 5. You can simultaneously ground, get early morning sun. You can do this with someone you feel safe with to release feel-good hormones like oxytocin, dopamine, and endorphins. So it's fun with kids, grandkids, even teens. I do this with my daughter. You can share the technique with loved ones and friends or even coworkers, especially those you spend a lot of time with, because regulated nervous systems create healthier relationships. And you can also, so for the song, you want to pick the same song and do that for a certain period of time so that your brain associates it with regulation and momentum. So you do want to do it for a little while, and but if the song no longer resonates with you, you can pick a different song and change it up. But you do want to stick with it. You don't want to do a different song every single day. You need to teach your brain to associate a particular song with regulation and momentum. So do it for at least a couple weeks, 2 to 4 weeks, and then you can keep the same song for a long time if you want, or you can change it up. It's whatever you resonate with. So you also, like, let's say you're not feeling good during the day or you need some momentum, you can play the song whenever you need motivation because your brain will associate it with regulation and momentum. And then after about 4 weeks, you don't want to do it right away. You can add simultaneous vibration, like maybe standing on a vibration plate. So this is a good technique if you have a hard time with sitting still, like meditating or journaling or EFT tapping. Like, let's say you just have a hard time with those kinds of things. Try this for a little while and then revisit those other techniques later on. And you might be able to do those techniques once your nervous system is a little more regulated. And then my last slide here is, how do I know if I'm overdoing it? So you can journal to see how you feel 5 to 10 minutes after the technique and keep track of how you feel over time. If you feel any of these reactions, you're going to do less. So you can do fewer of the steps or less repetitions of each step before moving to the music. So if you get a headache, nausea, dizziness, extreme fatigue, body aches, pressure, pain, and or swelling, that just means that your body is not ready to receive this yet, and you just tiptoe your way in, do a little bit less, and then try it again, do a little bit less, and just modify it as needed. So I hope you found this helpful, and I hope you give it a try. And I'd love to hear from anybody if you found this helpful, or if you share it with somebody else, or even in the comments, you can put down what song you like to listen to. Um, any comments, I'd love to hear it. Or if you have any questions, be sure to post them below. So it was great being with you today. Thank you and have a great day.